We're joined today by Mia Haney, CEO of the Pennsylvania Homecare Association. The Pennsylvania Homecare Association recently released an open letter to Governor Shapiro and legislative leaders, talking a little bit about your budget priorities in advance of them crafting this year's budget. What would you like them to keep in mind?
This year we have two really critical asks. One is to support the direct care workforce, which typically would be a caregiver or an aide, and the other is to support nurses. We are obviously home care, home health, and hospice services are what we provide, but they're all based in people's homes and communities, and our workforce is in crisis. We don't have enough workers, and we don't have the right reimbursement to support pay increases that would pay them adequately to keep folks coming to the industry, to retain them in the industry, and most importantly, to ensure that we're delivering the highest quality of care.
Before we get into the specifics on those policy issues, who typically is your workforce?
Our workforce would be a caregiver or a nurse, and really all ages and backgrounds, but very commonly, especially for our caregivers, we find a lot of single moms. Females tend to come to this industry more so than males, but we have everybody, and we are really looking to support them and ensure that they can support their families through a job that's meaningful, but also provides them the financial support that they need.
In this open letter, the Home Care Association is calling on the state to increase reimbursement rates for in-home care. How do Pennsylvania's reimbursement rates compare to those of neighboring states?
Unfortunately, we are amongst the lowest, if not the lowest. So for non-medical services, which would typically be provided by a caregiver, our reimbursement rate is around $20.63 on average, and we are lower than all contiguous states by $4.50 at least. For example, West Virginia is at $25.44 compared to our $20.63. Makes it very challenging to compete, and certainly makes jobs in neighboring states just right over the border very attractive to this workforce. Additionally, for nursing services, our rates are similarly lower than our contiguous states.
Can you explain the role that Medicaid plays in the funding of home care?
Yes, so for the services that we primarily are supporting and talking about in this policy session, those are personal assistant services and private duty shift nursing. So that's shift nursing services for pediatric and adult patients. Both of those are primarily funded through Medicaid. Medicare does not typically cover those services, nor do third-party insurances.
What type of rate increase are you seeking?
For our nursing services, we're looking for a $9 an hour rate increase. For our caregiver services or our personal assistant services, we are looking for a 22% increase this year, with a long-term goal of getting to a rate that would be the average of our contiguous states, which is around $28 an hour.
How great of a need is there for home care in Pennsylvania?
Oh, the need is so significant and growing. So there are about 300,000 people receiving these services today through these Medicaid programs, and a variety of private pay options as well. But we also, anticipate the need is just going to grow. Right now, older adults in Pennsylvania represent 1 in 4 residents. By 2030, that'll be 1 in 3. And so our large aging population is a great concern to us, because we are already in crisis from a workforce perspective, and we want to ensure that we can continue to deliver quality services, that when you call, when you have that need, when your mom is sick or suffering from dementia or whatever it might be, that when you call for care, they're not saying it'll be 3 to 4 weeks before we can get someone to you, or I'm sorry, we don't know if we'll be able to get someone to you, and that you have the consistency and peace of mind of knowing that I have a caregiver, I have a care worker, there's a backup plan, and it's a solid one. We can't definitively say that today because of the workforce crisis that's in front of us.
In your open letter to lawmakers, you cite that some home care workers are leaving for work in other states because they have more competitive wages. Beyond the reimbursement rate increase, are there other policy changes that you're seeking that could help perhaps entice and grow this workforce?
Yes, we actually are very grateful that we had some policy changes last year that essentially helped to make it easier for our folks to get hired. We had a face-to-face interview requirement that we were able to get changed to be allowed to be virtual interviews, and then allow that orientation and first day to be face-to-face, but just make the process faster. And we also saw some administrative burden lifted in our hospice services. So we're really grateful for the support that we receive. We'll continue to be looking at policy change that will drive meaningful change for our industries here in Pennsylvania, but we're really focused on those reimbursement rate increases this year.
Are there particular regions of the states that are more affected by this worker shortage?
I would say that everybody is affected, but we do have for our personal assistance services, so for those non-medical services that are bathing, grooming, transportation, assistance with mobility, we have rate regions in the state that are dictated by state policy, Medicaid fee schedule, and the lowest rate in the state is actually in the Pittsburgh region. So they are under a $20 an hour rate and really challenged by the ability to be competitive with just regular retail, gas station work, drivers, et cetera, even warehouse workers. We're all competing for the same people, except that we are limited by a reimbursement rate coming from Medicaid that is truly impacting the recipients of care, right? The workforce, they need the funds, deserve the funds because they're providing such an essential service. But the recipients of care are the ones who are most impacted. You know, we constantly are talking to families who are saying, I need care and I can't find anyone who can help me get access to it. And we're saying, well, the process is really complex and it's challenging to get through. And even once you get through it and you get authorized, it might be a little while before we can find staff for you. Really, the people who are hurt most by this workforce shortage are the recipients, and it's really important to remember them in all of this because them and their family members, their sons, their daughters who are out there working, who are taking on the burden of care, they are the ones that are feeling the stress of this, that are impacted by the anxiety that care carries, and we really need to do better by them.
Can you talk a little bit more to that recipient experience, particularly if you know, as you're dealing with a worker shortage, what they have to deal with on their end as a result of not having enough staff?
Yeah, so unfortunately and too often we see care recipients or participants who are part of this program getting phone calls from our providers, our agencies that are doing their best to find backup staff. So maybe you have your normal worker, your normal nurse, but she's got a kid who's sick and she needs to stay home that day. Well, because of that, you are now looking at a potential of a missed shift, which means that nobody's going to come that day and you need to find natural supports to support your family member. And for especially children who are on trachs or have vents or trachs, this is a very dire situation that could result in them being hospitalized. So it's so important that we remember that the recipients are on the other end of this and don't always have the ability to bring their collective voice together and tell their policymakers how much this is impacting them. We have folks, you know, it's a very sensitive subject to allow somebody into your home that you don't know and to have them help you with things like bathing. And a lot of times I used to kid that it is kind of like a dating app. You know, sometimes the first person who comes isn't the right fit. Historically, as a former provider myself, we had options if that person wasn't a good fit, right? Hey, there's a good fit out there. You could go on a few dates before you find the right one, but that option is just not available anymore. And you know what it means is that we've got people in their homes that are sometimes uncomfortable and wanting somebody new, but afraid to say anything because it would be worse not to have any care. So these are real scenarios that are happening, and you know, the reality is that some of the homes that we go into have all kinds of needs. Homes where we walk in and there's no cleaning supplies, but you know, obvious need for cleaning. We have homes where we go and there's no food, and who's gonna find food for this individual? And we are paying the worker who goes in there to this situation, you know, anywhere from $12 to $13 an hour to try to figure out how we're going to resolve this when they have no money in their bank account. It's a really challenging scenario, and we as an industry need to rally around our workforce and around these recipients and say, you deserve better. And Pennsylvania, as a leader in the aging population, should be setting the tone for how we treat our aging population, our older adults, and those living with physical disabilities, and our medically fragile children.
Pennsylvania is part of an interstate nurse compact that allows nurses to work in other member states. How does this agreement fit into Pennsylvania's need for caregivers?
Great point. So in theory, that should be helpful. However, the way that we've set it up in Pennsylvania, actually now it makes it easier for them to go into other states where the rate is higher. So while in theory this was like, great, we can get people working here, why would you want to come into Pennsylvania if in New Jersey or in West Virginia or in Delaware you can go and get a much higher rate? And so it's actually making it easier to lose folks to other states.
You had mentioned that sometimes because of the worker shortage, somebody might need to actually seek out help or hospitalization as a result of not having that home care provided. Is there a benefit to having home care provided both economically and perhaps for other reasons as well, as opposed to hospitalization or a nursing home type facility?
Absolutely. So home care typically is about 50% less than a nursing facility stay. And anyone who's received a bill from a hospital stay knows that hospital stays are extremely expensive. And if we think about our medically fragile children who are receiving care at home, very frequently we work with Geisinger Danville, or we work with the large hospitals in Philadelphia, and they're talking to us about patients who are pediatric, who are ready to be discharged to home, but cannot discharge unless we know that there's going to be nursing there to support them, right? They will end up right back in the hospital if nursing is not there to support them, and they're not releasing them because they don't have adequate staff in the home. That is a reality. We deal with discharge planners every single day in our industry who are keeping people in facility settings longer because home care doesn't have adequate workforce.
Can you talk a little bit more about the economic impact of the home care industry in Pennsylvania?
Absolutely. So we are so much larger than I think most people think. We employ about 290,000 employees across the state. We have at any given time 376,000 job ads posted. And uniquely, we have 5,000 brick and mortar locations across the state. Those are actual offices in all 67 counties. So we are a very large contributor from an employer perspective, from a revenue perspective, and from a taxpayer's perspective.
You've called on the Office of Long-Term Living to release its actuarial study of Pennsylvania's reimbursement rates. What do you hope to glean from this information?
So the last time that we did a study of the personal assistance services rate, it was released in 2012, and it was using data prior to 2012, obviously. So that's over a decade ago, and our rate setting was set at that point based on those rates. There have been very minimal reimbursement rate increases since that time, and so this new rate study is essentially like resetting, hey, this is what the actual need is. And so when we talk about the need for a 22% rate increase in this year for personal assistance services, we base that off of the 5 states that they are using to inform that rate study, and we took an average of those 5. And we had to do that because the rate study has not been finalized yet, and we're really hopeful that the executive review will be finished and that we will see the results of this rate study that we've been waiting on since October of last year.
As we anticipate the governor's budget address next week, in prior years he's called for an increase in the minimum wage. If the legislature were to increase the minimum wage, does that help home care workers?
All of our surveys that we have seen indicate that home care workers are being paid far above minimum wage today, although because our minimum wage is at $7.25. It still doesn't make us competitive with the other industries that we are now competing with in a post-COVID environment. So we are supportive of minimum wage increases, certainly, because it benefits our workforce in general, but we don't see that in the short term having an immediate impact because anything would likely be stepped in, and we are already kind of higher up in that stepping process.
You are serving in this particular role over roughly about the past year now.
Yes.
Prior to that, you had a separate a career in the home care, personal care industry. Can you talk a little bit about your experience and how that impacts your perspective as you're serving in your current role?
Absolutely. So I had a very unique experience in that it was my family's business that my parents started, and I was working in the family business for about 7 years with them, and then continued in that business for about 8 years after they retired. I am so passionate about this industry, and when we originally were building the business and the different service lines and what we needed to offer and how we trained our workers, we did it all around my grandmother. My grandmother was aging in Western Pennsylvania. We were in Eastern Pennsylvania. She was a 3.5-hour ride away, and their needs came up every single day that we just had never anticipated before. And so as we thought about how we wanted to run our business and grow our business and contribute and give back to our communities, we really based it off of her. And she has since passed and was a great inspiration for me in my career. But I now am helping to care for my 100-year-old grandfather who lives 20 minutes from me. So conveniently, very much closer. Some really good learned lessons over the years. But I have to tell you, this industry, it leaves an impression on your soul. I have worked with patients and their families that we are in it together. I have cried on the phone with patients over our inability to get staff there and how challenging that is and what it means for them. I've also celebrated with the successes that we have and finally finding a caregiver that was the perfect fit for their family and is driving so much meaningful value to their quality of life, to their general happiness. We've seen people come out of home care with health outcomes that just would never have been achieved in a nursing facility. Everyone wants to stay at home. I have not ever met somebody who's like, I think I'd rather go to the nursing facility than stay in my home. They all want to stay home. They want to stay where they're comfortable, and they want to live independent lives that are directed by them. Person-centered is what home care is all about, and we're here to support their journey, and that journey looks different for everybody, and it's what makes home care so unique, but it is also what makes us so special.
As the budget address occurs next week and will be likely several months until the final budget product is decided, what will you and members of the home care industry do to advocate for an increase in funding?
We are educating. So many people have no idea what home care services look like, how people get access to them, and you really don't have to know until you're in it, and sometimes that's a little too late because it's a lengthy process. So we're doing a ton of educating, speaking with all of our state representatives, our legislators, and making sure that they remember us and they prioritize us. But we're also doing home visits and getting out there and making sure that we're visible. It is so hard to get an aging population and bring them to Harrisburg. That's an impossibility. But with technology, we think we could get their stories out there in a meaningful way.
Mia Haney, thank you for joining us.
Thank you so much. This has been my pleasure.